Hi, thank you for joining me for this video where we will continue our review of the axial skeleton. We will be looking at the vertebral column and the thoracic cage in particular. So last time we already saw this slide which shows us the three major parts of the axial skeleton. And next we will be focusing on the vertebral column. And sometimes you might see the structure being called the spine or spinal column. Let's start by asking, why do we have this structure? Why do we have this vertebral column that runs from the base of the skull all the way to the end of the pelvis? There are three functions that I want to highlight. First, vertebral column plays an important role in transmitting the weight. Remember, all structures that are located above, so superior to the pelvis, are attached to this one way or another. And it is the vertebral column that picks up the weight of all these body parts, being the bony structure that everything kind of hangs on. And from hips, the weight is transmitted to our lower limbs. Secondly, vertebral column has an important function in protecting the spinal cord. The spinal cord, as a continuation of the brainstem, runs inside this bony protective column. Here, think about why is it important. Well, you have seen that when an individual ends up in an accident where the spinal cord is damaged, this may result in a paralysis downstream from that point. So that is why we are so concerned about protecting our spinal cord, that evolution has even developed this protective casing for it. And finally, I want to mention vertebral column as an important attachment point for ribs and many muscles. So these are important functions of the vertebral column. And here is a nice review question. We have earlier learned about the bone classification. Remember this slide. Bones could be long, short, flat, or irregular. Now, where of these categories would we put the bones of the vertebral column? If you guessed irregular, you are correct. The 26 bones that form the vertebral column and are then classified as irregular in their shape. But let's simplify this for us. I have 5 regions of the vertebral column that I want you to know. These are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and sacrum, which in an adult is fused but initially starts as 5 parts, as well as coccyx, which again is fused but starts as 4 parts. So you might ask me how to remember the number of these vertebrae on each region. How I remember them, but you might have a better rule, is that they are all my meal times. 7 in the morning for breakfast, 12 noon for lunch, and 5 in the afternoon for dinner. And sacrum and coccyx are fused, so I do not worry about them. Anything that helps you to remember anatomy and physiology, go for it. And you have actually this diagram in your supplementary material too. What I want to talk next about with you is the fact that our vertebral column is curved, right? There are in adult 4 natural curves in the vertebral column. And the naming of these follows that of the naming of regions of vertebral column. But I have a question. Do we start like that? No, not at all. If you have seen a newborn recently, I am sure that you can still remember how their spine appears more like having a C-shaped curve. And then one starts to lift head, say, in approximately at 6 months age. The muscles strengthen and the neck curve starts to appear. And then at the age where crawling starts to become more pronounced, we see this developing further as, again, muscles have become strong enough to not only carry the head, but also carry the front part of the body or upper body, with the help of the front limbs. Eventually, as one starts to stand, approximately around 9 months, the lower back curve becomes more well defined. So there we have it, the development of the curvatures of the vertebral column. And interestingly, this is the reason why a newborn cannot just hop on their 2 feet and start walking around. The development of these curvatures as a result of strengthening of the muscles and the gradual changes in the spine structure need to proceed in this predefined order. I included this slide as I wanted to highlight that the vertebral column is strengthened by numerous ligaments. Another structure that we should talk about regarding the vertebral column is the fibrocartilage discs in between the vertebrae. These are cushion-like pads that allow a greater range of mobility. Think about it. Bone-to-bone contact of the vertebrae would give us only very limited range of movement for the spine, but by having these discs made of fibrocartilage, most of us are really able to bend our spine quite a bit. The other function that these discs allow is them acting as shock absorbers. Again, these are squishy and can eliminate a lot of the stress and impact that would be otherwise passed if it was only bone-to-bone structure. But always, everything does not go without problem. You can also end up with a disc that gets squashed and bulges out. These are our herniated discs, and you see here how a disc is bulging out of a lumbar region shown in this MRI scan. Compare it to other discs seen and you can see a clear difference. These are often caused by physical trauma, and a lot of the time what happens is that they end up pressing a spinal nerve and can be very problematic for a patient, either through pain or limiting their daily activities, or a combination of both. You might ask how to treat these. Well, exercising, massage, and heat are some of the softer approaches if it's not too severe, and if they are worse, then of course painkillers and even surgery. This varies a lot. Another clinically relevant problem that I want to mention is scoliosis. What happens here is that we have an abnormal spinal curvature, and sometimes, in a layman's language, these are known as hunchbacks. Do notice that these can be very serious, for example, causing breathing difficulties. Here is a very powerful X-ray of a patient with fairly advanced scoliosis. See the hips at the very bottom and how pronounced the curvature is. Therefore, much of the internal organs with the lungs included are hard pressed to function optimally. These occur mostly during the growth spurt, and luckily they are mostly mild in severity, but they can get more severe as one ages. And they can be very painful and very disabling. How to treat them, you might ask? Well, this would depend on the severity, but may include different kinds of braces and even surgical intervention. These picture pairs are before and after a surgery. Now, I want us to take a moment to look at a few parts of the vertebra. Think of this as a generalized structures, proportion of which we will apply as we look at the vertebra from different regions. But first, it's good for us to get a basic terminology right. So here we are looking at one vertebra from the top, looking down, and the back of an individual would be at the top of the screen and at the front at the bottom of the screen, like this. So let's look at different parts. The body forms the bulk of the vertebra. And we also have foramen. This was the term for the holes in these structures. So here it is in relation to the vertebra. And the part that connects the processes of the vertebra. Posterior part to the body is known as pedicle. We have transverse process more laterally and spinous process more posteriorly. These are connected by the lamina. We should also notice that there are various articulating facets. So those are some of the general terms that we need to be familiar as we start to look at the differences and similarities of the vertebrae from different regions. Okay, do you remember this slide that we looked at earlier? We will start from the top and work our way down. So let's look at the 7 first vertebrae. These are our cervical vertebrae. You can see that in comparison to what's to come, they are small and light in appearance. Remember, these are mainly carrying just the head. The 2 of the most superior ones are special. These are atlas and axis. They enable you to make the movements for yes and no. Now, next we have 12 thoracic vertebrae. They become larger as we move further down, with the body growing in particular. Also, the articular facets become bigger. If you think about it, it makes sense. Now these are starting to carry more cumulative weight, as in addition to the weight of the head, also the weight of the upper limbs and structures within the thoracic region are put here. Now, let's look at lumbar vertebrae. There's 5 of these, and if you compare to what we have seen earlier, they have massive bodies. After all, they deal with a great amount of weight and stress. If you look at their general appearance, I think it's also fair to describe them as being somewhat bulky in appearance. Finally, we have sacrum, which is fused from 5 bones, and coccyx, which is tailbone. It really has little function these days. You can consider it largely as an evolutionary remain. So there we have it, our full vertebral column. And before we wrap up this video, let's look at the last part of our axial skeleton. This is the thoracic cage. I will let you study this largely independently, but there are a few points that I want to highlight. Let's start by looking at the parts that make up the bony parts of the thorax and consider its functions. Well, we have our vertebrae of this region, of course, so this is 12 vertebrae. Which form thoracic cage's posterior boundary. Anteriorly, we have sternum, the chest bone, and costal cartilages. The latter provides an attaching structure from the ribs and sternum. And it is the ribs that form the lateral boundary of this region. In terms of the functions, we have thoracic cage protects the vital organs within it. It also supports shoulder girdles and upper limbs, and finally, as we have seen before, providing attachment sites for many muscles is going to be vital. And this is why I want us to do a good job of understanding the skeleton, as much of our study of the muscles will depend on knowing these attachment sites. Let's look at the chest bone a little more in detail. And this is our sternum, of course. Here we have 3 parts to look at. So let's start with the body of the sternum. So this is the largest area forming the mid part of the chest bone. And then we have manubrium, which is the superior part. And finally, inferiorly, we have the xiphoid process. And there can be all sorts of clinical conditions with this structure, like xiphoid process being missing or it projecting posteriorly. The latter would be problematic, of course, as there would be a risk of puncturing the heart or the lung. Next, I want quickly to talk about ribs. those ribs that are attached directly to the sternum, although it be through costal cartilage, are known as true ribs. And there are 7 pairs of these. And then we have something that we call false ribs. They are rib pairs 8, 9, and 10. And then they are called this because they do not directly attach to the sternum, but join through the costal cartilage of the 7th rib. And finally, the 2 rib pairs that do not attach the sternum at all, they are known as floating ribs. Sometimes you might hear people doing strange stuff like wanting to get them removed to make their thin waist and all that. So those are our ribs. You might ask why you need to learn these. Well, for example, to listen to heart with a stethoscope or position the leads for ECG. Recently it was Valentine's Day, right? Well, what's the best way to get to the heart of a man? Well, incision between the ribs, these are known as intercostal spaces, so I'd say that between 2nd and 5th would be likely most successful. Finally, before we call it a day with this video, I want to just briefly show a few parts of a typical rib. Here we see a posterior view of, I believe, the 6th rib. Let's look at some of the structures there. So the head is at the posterior end, and the shaft covers most of the rib. This is very flat, and neck instead follows the head. It is a thinner part, like a neck. And notice we have these attachment points where the rib articulates with the vertebral column. Just like this. So that is a typical rib. Of course, they vary in size and shape, but these structures are generally seen in all of them. This concludes our study of the axial skeleton, and in the next video we will start to look at the appendicular skeleton. I will see you then.